Interstitial cystitis, often abbreviated as IC, is a chronic condition that causes bladder pressure, bladder pain, and sometimes pelvic pain. Diagnosing IC can be challenging because its symptoms often overlap with other urinary tract disorders. In this video, we'll walk you through the step-by-step process doctors use to diagnose interstitial cystitis, helping you understand what to expect if you or someone you know is experiencing persistent bladder discomfort. Let's start by understanding why a thorough diagnostic process is necessary and what makes IC unique among bladder conditions. The diagnostic journey begins with an initial consultation. During this visit, the doctor will ask about your symptoms, such as how often you urinate, the severity of your pain, and any triggers you've noticed. They'll also inquire about your medical history, including any previous urinary tract infections, surgeries, or chronic illnesses. This conversation helps the doctor form a preliminary picture and decide which tests may be necessary. It's important to be open and detailed, as this information guides the next steps in the diagnostic process. After gathering your history, the doctor will perform a symptom assessment. They may ask you to keep a bladder diary for several days, recording how often you urinate, the amount, and any pain or urgency you feel. This diary provides valuable insights into your daily patterns and helps distinguish IC from other conditions. The doctor will also ask about pain, location, intensity, and whether it worsens with certain foods or activities. This step is crucial for narrowing down the diagnosis. Next, a physical examination is performed. The doctor will gently examine your abdomen and pelvic area to check for tenderness or abnormalities. In women, a pelvic exam may be done to rule out gynecological issues, while in men, a prostate exam might be included. This hands-on assessment helps identify any physical signs that could point to other causes of your symptoms, ensuring that nothing is overlooked in the diagnostic process. A key step in diagnosing interstitial cystitis is urinalysis. The doctor will ask for a urine sample to check for signs of infection, blood, or other abnormalities. This simple test helps rule out urinary tract infections or other conditions that can mimic IC symptoms. If the urinalysis is normal, it increases the likelihood that your symptoms are due to IC rather than an infection or kidney problem. If the urinalysis suggests infection, a urine culture may be ordered. This test involves growing bacteria from your urine sample in a lab to identify any specific organisms causing infection. A positive culture points to a urinary tract infection, not IC. If the culture is negative, it supports the possibility of interstitial cystitis, helping to further narrow the diagnosis. Blood tests may also be performed to check for signs of infection, inflammation, or other systemic conditions. These tests can help rule out diseases such as kidney problems or autoimmune disorders that might cause similar symptoms. While blood tests alone cannot diagnose IC, they are an important part of the process to ensure a comprehensive evaluation. A pelvic ultrasound may be recommended to visualize the bladder, kidneys, and surrounding organs. This imaging test helps detect structural abnormalities, tumors, or stones that could explain your symptoms. A normal ultrasound result supports the diagnosis of IC, as it rules out many other potential causes of bladder pain and urinary issues. If initial tests are inconclusive, the doctor may recommend a cystoscopy. This procedure involves inserting a thin tube with a camera into the bladder through the urethra. Cystoscopy allows direct visualization of the bladder lining, helping to identify characteristic signs of IC, such as Hunner's ulcers or pinpoint bleeding. It's a key diagnostic tool when other tests don't provide clear answers. During cystoscopy, you'll be asked to lie on an exam table while the doctor gently inserts the cystoscope. The camera transmits images to a monitor, allowing the doctor to inspect the bladder wall for inflammation, ulcers, or other abnormalities. The procedure is usually done under local anesthesia and takes only a few minutes. It's generally well tolerated and provides valuable diagnostic information. Sometimes, hydrodistension is performed during cystoscopy. This involves filling the bladder with fluid to stretch it, which can reveal subtle changes or pinpoint bleeding characteristic of IC. Hydrodistension may also temporarily relieve symptoms in some patients. The findings from this procedure help confirm the diagnosis and guide treatment options. In some cases, the doctor may take a small tissue sample or biopsy from the bladder wall during cystoscopy. This sample is sent to a lab for analysis to rule out cancer or other diseases. Biopsy is not always necessary, but can be helpful if there are unusual findings or if the diagnosis remains uncertain after other tests. Another specialized test is the potassium sensitivity test. Here, the doctor instills a potassium solution into the bladder and observes your response. If you experience increased pain or urgency, it suggests the bladder lining is more permeable, a feature seen in IC. However, this test is not commonly used due to discomfort and limited specificity, but it may be considered in complex cases. A crucial part of diagnosing IC is ruling out other conditions with similar symptoms. These include urinary tract infections, bladder cancer, kidney stones, sexually transmitted infections, and gynecological disorders. The doctor uses a combination of history, physical exam, lab tests, and imaging to systematically exclude these possibilities, ensuring the diagnosis is as accurate as possible. Doctors also consider how long you've had symptoms. IC is typically diagnosed only if symptoms have persisted for at least 6 weeks without infection or other identifiable causes. This timeframe helps distinguish IC from temporary bladder irritation or acute infections, reinforcing the need for a careful and patient approach to diagnosis. The pattern of your symptoms is also important. IC often causes pain that worsens as the bladder fills and improves after urination. Some patients notice flares triggered by certain foods, stress, or hormonal changes. Recognizing these patterns helps the doctor differentiate IC from other bladder disorders and tailor the diagnostic process to your unique experience. Doctors may use pain mapping to better understand your symptoms. This involves asking you to point to or describe the exact location and nature of your pain. Sometimes, diagrams or models are used to help you communicate more clearly. Pain mapping can reveal whether the discomfort is truly bladder-related or if it might stem from other pelvic organs. Avoiding diary is another valuable tool. You'll be asked to record every urination event, including time, volume, and associated symptoms, over several days. This detailed record helps the doctor identify patterns, such as frequent urination or small bladder capacity, which are common in IC. The diary also provides objective data to support the diagnosis. Doctors may use standardized questionnaires to assess the severity and impact of your symptoms. These forms ask about pain, urgency, frequency, and how your symptoms affect daily life. The results provide a structured way to track changes over time and compare your experience to established diagnostic criteria for IC. A pelvic floor assessment may be performed to check for muscle spasms or tenderness. Tight or dysfunctional pelvic floor muscles can contribute to bladder pain and urinary symptoms. Identifying these issues is important, as they may require specialized physical therapy rather than standard IC treatments. Sometimes, a neurological evaluation is needed to rule out nerve-related causes of bladder symptoms. The doctor may check your reflexes, sensation, and muscle strength. This step is especially important if you have symptoms like numbness, weakness, or changes in bowel function, which could indicate a neurological disorder rather than IC. In rare cases, allergy testing may be considered, especially if symptoms seem to flare with certain foods or environmental exposures. Allergies can sometimes mimic or worsen IC symptoms, so identifying and managing them can be an important part of the diagnostic process for some patients. Urodynamic testing measures how well your bladder and urethra store and release urine. This series of tests can help identify functional problems, such as overactive bladder or poor bladder emptying, which may mimic IC. The results help the doctor distinguish IC from other urinary disorders and guide appropriate treatment. Beyond ultrasound, other imaging tests, like CT scans or MRI, may be used in complex cases. These advanced images provide detailed views of the urinary tract and surrounding organs, helping to rule out rare causes of bladder pain or urinary symptoms. Imaging is especially useful if there are warning signs like blood in the urine or unexplained weight loss. For women, a thorough gynecological evaluation is often part of the diagnostic process. Conditions like endometriosis, pelvic inflammatory disease, or ovarian cysts can cause symptoms similar to IC. The doctor may perform a pelvic exam and order additional tests to ensure these possibilities are considered and appropriately managed. For men, a prostate evaluation may be necessary. Prostate problems, such as prostatitis or benign prostatic hyperplasia, can cause urinary symptoms that resemble IC. The doctor may perform a digital rectal exam and order blood or urine tests to assess prostate health and rule out these conditions. Testing for sexually transmitted infections, STIs, may be recommended, as some STIs can cause urinary symptoms similar to IC. The doctor may collect urine, blood, or swab samples to check for infections like chlamydia or gonorrhea. Ruling out STIs is an important step in the diagnostic process, especially for sexually active individuals. Bladder cancer can sometimes present with symptoms similar to IC, such as pain and blood in the urine. If there are risk factors or warning signs, the doctor may order additional tests, such as urine cytology or imaging, to screen for cancer. Early detection is crucial, so this step is taken seriously if there's any suspicion. Kidney function tests may be performed to ensure your kidneys are working properly. These tests measure substances in your blood and urine that reflect kidney health. Abnormal results could indicate a kidney problem rather than IC, guiding the doctor toward the correct diagnosis and treatment plan. Autoimmune diseases, such as lupus, can sometimes cause bladder symptoms. The doctor may order blood tests to screen for autoimmune markers if there are signs of systemic illness. Identifying an underlying autoimmune condition is important, as it requires a different treatment approach than IC. Chronic pain conditions like IC can be influenced by psychological factors, including stress, anxiety, or depression. The doctor may ask about your mental health and, if needed, recommend support or counseling. Addressing psychological well-being is an important part of managing chronic conditions and improving overall quality of life. Diet can play a significant role in IC symptoms. The doctor may review your eating habits and suggest an elimination diet to identify foods that trigger flares. Common culprits include caffeine, spicy foods, and artificial sweeteners. Understanding dietary triggers can help manage symptoms and improve quality of life. A medication review is also important. Some drugs can irritate the bladder or cause urinary symptoms. The doctor will ask about all prescription and over-the-counter medications you're taking to identify any that might be contributing to your symptoms. Adjusting your medication regimen may help alleviate discomfort. Doctors may ask about your family history of bladder problems, autoimmune diseases, or chronic pain conditions. A family history can sometimes increase your risk for IC or related disorders. This information helps the doctor understand your overall risk profile and tailor the diagnostic approach accordingly. A review of systems is a comprehensive checklist of symptoms affecting different parts of your body. The doctor will ask about issues like fatigue, joint pain, rashes, or gastrointestinal problems. This broad review helps identify other conditions that might be linked to your bladder symptoms or point to a systemic illness. Doctors use established diagnostic criteria to confirm IC. These criteria include chronic bladder pain, absence of infection, and exclusion of other causes. The combination of history, physical exam, lab tests, and imaging forms the basis for diagnosis. Meeting these criteria ensures that the diagnosis is accurate and evidence-based. Diagnosing IC often requires a multidisciplinary approach. Urologists, gynecologists, physical therapists, and sometimes pain specialists may all be involved in your care. This team-based strategy ensures that all possible causes are considered and that you receive the most comprehensive evaluation and support. Your involvement in the diagnostic process is vital. Keeping detailed records, communicating openly with your healthcare team, and following through with recommended tests all contribute to a more accurate diagnosis. Being proactive helps ensure that nothing is missed and that your unique experience is fully understood. Diagnosing IC can be challenging due to overlapping symptoms with other conditions and the lack of a single definitive test. It often requires patience, persistence, and a willingness to explore multiple possibilities. Understanding these challenges can help set realistic expectations and encourage ongoing collaboration between you and your healthcare team. To summarize, diagnosing interstitial cystitis involves a careful, step-by-step process. Initial consultation, symptom assessment, physical exam, lab tests, imaging, specialized procedures, and exclusion of other conditions. Each step builds on the previous one, ensuring a thorough and accurate diagnosis. This comprehensive approach is designed to provide clarity and guide effective treatment. Early diagnosis of IC can make a significant difference in managing symptoms and improving quality of life. The sooner the condition is identified, the sooner appropriate treatments can begin, potentially reducing pain and preventing complications. If you suspect you have IC, seeking medical attention promptly is key. Living with interstitial cystitis can be challenging, but a clear diagnosis is the first step toward effective management. With the right support and treatment plan, many people find ways to control their symptoms and maintain a good quality of life. Remember, you're not alone. Support groups and resources are available to help you navigate this journey. If you experience persistent bladder pain, frequent urination, or other urinary symptoms that don't improve, it's important to seek medical advice. Early evaluation can help identify the cause and start you on the path to relief. Don't hesitate to reach out to your healthcare provider if you have concerns. Research into interstitial cystitis is ongoing, with new diagnostic tools and treatments being developed. Advances in imaging, biomarkers, and personalized medicine hold promise for more accurate diagnoses and better outcomes in the future. Staying informed about these developments can empower patients and healthcare providers alike. In conclusion, diagnosing interstitial cystitis is a detailed, step-by-step process that requires careful evaluation and collaboration between patient and doctor. By understanding each stage of the diagnostic journey, you can be better prepared and more confident in seeking the care you need. Remember, a thorough diagnosis is the foundation for effective treatment and improved quality of life.